How many of you are aspiring doctors who are confused as to which specialty to choose? All right. Well, let me introduce you to the most exciting and demanding field of medicine, the aesthetic medicine. Hi, I am Professor Dr. Ajay Rana, consultant dermatologist and aesthetic physician, founder and director of the Institute of Laser and Aesthetic Medicine, ILAMED. In the beginning of my career, I got fascinated to aesthetic medicine, but I had a void as I myself had to go to Germany to further my education in the field of aesthetic medicine. When you talk about aesthetic medicine, what is aesthetic medicine? Well, aesthetic medicine is mainly focused towards improving the cosmetic appearance of the individual using medical procedures instead of any reconstructive procedures. You must have heard of procedures like Botox, fillers, chemical peels, PRPs. All these procedures, they fall under the domain of aesthetic medicine. The scenario of aesthetic medicine in India, when we started actually, it was not organized. Aesthetic medicine education in India was not organized, and very few people who were practicing this particular field were not willing to teach others. Of course, the reason was they were afraid that it might create competition in the market for them only. So I realized broadly that that aesthetic medicine, the education has to be restructured, reframed, and two, the notion of aesthetic medicine in the minds of people has to be changed. People, when we started to practice, I started to observe affluent classes or celebrity grade individuals. They were the ones who were opting for these procedures. Rest of the general public was merely feeling shy, as of probably feeling that this is quite expensive procedure, or they had the notion that this is something related to luxury. Probably this is not for them. With this, I embarked the mission to restructure the aesthetic medicine education in India by creating Institute of Laser and Aesthetic Medicine, ILAMED. When I started the idea of this institution, of course, I got a lot of comments and a lot of resistance in terms of if you start to train others, you will generate a lot of competition in the market. It will be difficult for you, it will be difficult for us. But I never felt the same way. I always felt education is like a river. If you, at any point of time, if you stop the flow of the river will tend to take some other way. But you cannot just stop that flow of water of the river and so on. I knew it is either me or somebody else. But end of the day, it will be done sooner or later in the future. So I moved on with this idea, and the Institute of Laser and Aesthetic Medicine was formed actually. All right. All these years, all these past 18 years, we have trained more than 2 lakh physicians in the country. And the scenario now is that not only the metro cities, if you go to smaller towns, you will find these procedures being done. So availability of the procedures happened actually. And with the availability, the awareness increased actually. So if you go and talk to someone, let's say in a smaller town, and you talk about, let's say, laser hair reduction, you will see they know something. It is not like the previous time when people will start to come and talk to you and ask you that, doctor, I have heard laser causes cancer. What do you think about it? Yes, still, I mean, I would say very few or rarely this question might come from one or the other, but by and large, everybody understand that these are non-ionizing radiations. There are no major problem as such. This is something you can get it easily. This can certainly change your lifestyle. This can certainly help in your day-to-day work. So everybody noticed and accepted it. Another example, if you go and see in these cities earlier, the brides-to-be, they used to go to parlors, salons for getting their pre-bridal packages or something, which now they have shifted to the clinics actually. They go to their cosmetic clinics to get these packages done. So the overall confidence and the overall education or overall feeling of this particular field has by large increased. How it helped the country? See, we have one particular field of medicine widespread in the country, available in the country. Teaching the physician means educating or teaching the public by large. If you do not have a trained physician, how you expect population by large to know about it? And the second thing is the cost. The cost was the limiting factor initially when we started. Mainly the people were afraid, mainly the people were just cutting shy from these procedures because the cost was quite high. So education brought in another thing in the country is lowering down the cost. These particular procedures became easily available. As the skilled manpower has increased, ultimately the cost went down. The cost went down, so the availability went up and so on. All right. So that is something which basically has happened in these years. Following this, the development of aesthetic medicine which has happened in the country in 18 to 20 years, it has gone further. I felt the need of unifying the whole country, the whole field of medicine, aesthetic medicine, with the vision of which I founded the Indian Society of Aesthetic Medicine under the International Union of Aesthetic Medicine, what do you call Union International, the Medicine Aesthetic, UMI. I made India the 31st country in the world. There are now more than 47 countries, mainly Europe and US. And I made India the third in Asia after South Korea and China. So I tried to unify this so as everyone who is practicing pan-India from J&K to Kanyakumari, from Guwahati to Mumbai, Pune, Ahmedabad, everybody should be in line with one particular protocol and system actually. During my 20 years of practice, I have seen a major change. Not only in the field of dermatology, but I have seen a major change that all these new generation, all these youngsters, young doctors, dynamic people, they have started to enter the field of aesthetic medicine quite early in their ages. When we went into medicine, the idea was to be a successful doctor, you will be spending your whole lifespan. Then only you will become successful. Then you will be probably rich and known. That is not the case now. So, if you see why one, the revenues this particular field generates for the operating physician is extremely beautiful. It's fantastic. All right, so the revenues are quite high. For each procedure you do, the revenues you generate out of it are remarkable. This is good. Second, if you see work-to-life balance, all right, work-to-life balance, people they say, how come you get time to go to the gymnasium? People they ask, how do you do parties at night? Well, when you work 10 to 7, you can do all that stuff. You can maintain your life because you are not really operating on severely ill patients. You do not have any emergencies as such. So you have a good lifestyle. You maintain a good lifestyle. Not to mention beauty is a global idea. This is a global idea. Beauty is global. You go any part of the world, you are sitting here, you go to Paris, you go to New York, you go to Tokyo, you go to Bangkok, you go anywhere. Beauty has one language only. So you are recognized everywhere in the world. You can be a faculty member, you can be a part of their organization, you can be their mentor, you can be their student, You can work in these part of the world everywhere. So that has opened up a lot of opportunities for these young doctors. Then the changes which we give, immediate changes. What you do for patients, you did, let's say you did a liquid rhinoplasty for the patient, you did the nose job, non-surgical nose job for the patient. Well, 10 minutes, the lady is leaving the center with a new looking, good looking nose. Isn't that amazing? Yes, that's amazing. Who does not want things immediate? Everybody wants it immediate. So immediate changes makes you more recognizable. People, they understand your value better. Plus your clients who are there. These are the people, you are interacting them. These are who's who. They are educated people. You make a lot of good followers. In a clinical medical setup, let's say as a gynecologist, as an orthopedician, how much history I will be taking from a patient? How closely I can discuss with this patient? Not really too much. I'll be into the clinical stuff only. But as an aesthetic physician, I can discuss where they come from, what they do, how they do. They will always have a discussion with me and so on. Why they want to get it done? What is their future? So everything you know actually. So you have a better understanding. In the long run, you end up knowing a lot of people who are who's who. And again, that is something which you like. That makes you a brand. So your branding is early in life. You don't have to spend many years to become a brand. You become a brand early. You become rich early. What do you want in your life? This is something easy, nice. You want that. Everybody wants that. Last but very important aspect is the holistic approach of this. I'm not sure how many of you actually know that aesthetic does not only mean beautifying someone. Everybody looks at it like, oh, probably, she's gonna do her lips, she's gonna do her nose, or he wants to get her, face a little chiseled. But no, that is not the case. A child who has a burn on the face, on the body, who the parents of this particular child who are suffering, who are worried that what will happen to this girl child when another 10 years when she will not get married? What would I do with her? How? What? So that is something which is again not only for that particular, not only for that particular individual or that child. This is the stigma for the whole family. When you treat these kind of patients, you free them from this bondage. You make them confident socially. All right? This is one small example. Another example, let's say a person who's working like an airline crew member. This guy has to look neat and clean while serving the passengers. But if the whole shirt of that guy is drenched in sweat, because the person is suffering from what you call underarm excessive sweating, axillary hyperhidrosis, do you think the person would be able to retain the job for very long? Of course not. So if you change, if you help this person by injecting this person, by treating this person and make the person normal, well, the person can retain this job forever. There is no problem. There is nothing bothering this person. A guy who is saying, Doc, I'm going to join the armed forces, but I do have a tattoo on my forearm. Will you be able to remove it? Well, this is the question of the life of this young chap. He is getting recruited actually in the armed forces. So if you remove this particular tattoo from the arm of this person, you do not only serve this guy, you serve the whole family. So aesthetic broadly has a bigger dimension actually. And yes, it has attracted younger individuals into this particular thing and so on. ILAMED as a teaching institution has played a significant role in training aesthetic physicians by large in the country. But over the years, as the demand has gone high and the country dimension is quite big, you need to match up with further more trainings, and a lot of other institutions also came up and joined this particular aim actually. All right. As we are the oldest institution, we are proud that most of their founders and faculty members are being trained by us. So directly, indirectly associating and helping each other in this vision of aesthetic medicine. Well, for you as a physician, how to choose the right institution? Well, one, what brand you're looking at, which year the institution was established, and what is the faculty base of that particular institution. What are the international tie-ups of the institution? What are the curricula and different domains in that particular institution? For example, aesthetic medicine is now not limited to aesthetic medicine only. It is about aesthetic dentistry also, cosmetic gynecology also, and so on. What kind of infrastructure the institution has, and of course, the certificate, what value this certificate holds. Last but not the least, post-educational backups, what backup the institution provides you once you go back in the field as a trained physician. So all in all, if you see, with the increase in the education and bringing the cost down, ultimately has made India strong in the world when it comes to skin, hair and cosmetic procedures. The medical tourism globally, in one of the statements by the Economic Times, which states that India will end up becoming the leader in the global medical tourism by year 2030. So this can only happen if we educate our physicians and when we control the cost. All right, so that is only possible through this. So I hope all of you have a clarity in terms of you are a young physician and you want to do something in your life. You are looking and trying to figure out what specialization fits best for you. I think this is my answer to you. Thank you.